For sake of time, we're going to move on to our case presentation. So let me turn it over to Affinia Healthcare, Sonia or LaTonya. I'm not sure who's presenting, but go ahead, take it away.
Okay, so this is Sonia Deal and LaTonya Lee from Affinia Healthcare. LaTonya Lee is a community health worker who works with our patients as well as a project coordinator for our public housing initiative. And I am the Director of Practice Transformation with Affinia Healthcare. We are working on best practices for assisting public housing participants on smoking cessation for those who are motivated to stop smoking. Thank you. So today our presentation is about a young lady who she is motivated to stop smoking. She's a 41-year-old female, African-American. She has a history of asthma and COPD and bipolar disorder. She is also on inhalers, and she has been trying to quit smoking, so she has started self-medicating using marijuana instead of cigarettes, and also e-cigarettes to replace cigarettes. She is working at an organization that has a smoking policy, which is one of the other reasons why she's motivated to stop smoking, because they are banning smoking from the campus. Currently, she smokes 2 packs of cigarettes per day for 10 years. She has started, like I said, using e-cigarettes, 1 cartridge per day for the last 3 years, and just recently started using marijuana, 3 joints per day for 20 years. She has tried to stop smoking in the past. Some of the things that she has used has been a nicotine patch. Currently, she is, like we said, on inhalers. Some of the things that the community health worker has done was spoken with her, did a prepare tool, which we'll talk about in a little bit, and then also gave her information on the quit line. She did not make a formal referral because the individual said that she would reach out to the quit line herself, but we did give her the information for the Missouri quit line. Just a few of her vital signs: her blood pressure at that point was 160/90, her heart rate was 78, respirations 14, her weight is 255, oxygen 98% on room air, and a temp of 98.6. Other things that she has going on, of course, we can see with her blood pressure being elevated that she is diagnosed with hypertension and obesity. We did not find that she was on hypertension medications, so we do have an internal hypertension education group that she is being referred to as well. Some of her additional information, the participant feels like she has social support from her kids, and her family definitely wants her to stop smoking. I believe she's getting ready to become a grandmother, so she wants to be around for her family, and especially her new grandchild is definitely a motivating factor. She's tried to quit numerous times, but due to everyday life experiences and social and structural determinants of health, she has not been successful. She has lost her home and is going through divorce, which is one of the reasons why she reached back out to the things that gave her comfort, which is smoking and smoking marijuana. Like I previously stated, some of the socioeconomic and socio-demographic stressors have been a factor in her smoking. our system or workflow, what we would like to do is streamline the referral process for all patients and employees to the MOQUIT line. We are working on partnering with experienced smoking cessation counselors who are through our organization as well as the City of St. Louis Department of Health, and they are willing to do on-site tobacco education cessation for the community members, as well as do internal clinic tobacco cessation programs. Senior Healthcare is currently working with public housing to develop a referral process for the smoking residents, and that comes from utilizing the Prepare tool that we use to address and identify social and structural determinants of health, but it also comes from their health assessment, which was created by the Public Housing Authority and one of their agencies, their partnering agencies. How we are currently working, I did this in a two-part. LaTanya, when she spoke with the individual, the member states that her social group is really not helping out because as soon as they leave, she finds herself lighting up a cigarette. Her pain points are that she has not overcome her divorce and losing her home. She goes out with friends and tries to be more involved in family functions and church for some spiritual support. But from an organization standpoint, we utilize the Prepare tool to, number one, assess the members' determinants of health, but also to determine what kind of resources are needed for this motivated community member. So the community health worker, which is LaTanya, is currently working on finding support groups for members to assist with dealing with behavioral health issues. As we stated, her pain point is that she has not overcome losing her home as well as her marriage. So we're thinking that she may have some depression, which has not currently been diagnosed, but we will complete the depression screening tool the next time we connect with this member, and then also connect her with a behavioral health counselor or consultant to address her behavioral health needs. Our vision of what this looks like when it's working well, so we're actually in the thick of working an electronic process for the Prepare tool, which will do a few things. Number one, it will give us data, which we'll talk about in the next few sections, but it'll give us that immediate data to be able to look at raw information, but then also we want to be able to bring the resources out to the community for the community members, so that it's not only an internal process, it's also an external process. So our vision is for the individual is for her to stop smoking so that she can have a healthy lifestyle and won't have to be on medication. So that includes blood pressure medication as well as COPD, which we know the nicotine does not help with that. She desires to be able to start enjoying life without nicotine as a comfort. Organization-wide, our focus is to identify members impacted by social and demographic stressors, or SFPH, and connect them with the community health worker, which goes out and finds resources and brings resources to the community members and assists them with developing a plan of action. Realizing that the patients or community members have several concerns, we want to ensure that we address the barriers to health and wellness while connecting them to the resources and education to improve their quality of life and well-being. So the CHW does follow-up visits and phone calls with the members after connecting them to resources to make sure that they have actually connected with that resource And if they haven't, again, addressing any barriers to connecting to the resources. And if they have connected to the resources, we just want to find out how things are going. If things are not going well, then we want to make sure that we connect them to another resource. So we also will assess the members' level of readiness to change and that motivating factor for them to change. The recent changes that we've had within the last 6 months, we are currently working with the Public Housing Authority of St. Louis City to bring health screening and follow-on resources to public housing communities. We will be utilizing their health screening tool, which we have actually made electronic for them. And then we have also created the Prepare tool in an electronic form. And we're working on making that a Likert scale so that we will be able to see the progress over the next visits or the follow-on visits with the patients or community members. With the Prepare tool, we identify the community's personal and health needs, and from that screening, we have already partnered with other agencies and partners to develop and implement an action plan for those communities. So we're working also on making sure that any, thank you. We're working on making sure that any issues that are going on in the community, that we're connecting the community members with community leaders. And then also, part of what we're doing, we have an event coming up, and this is a major event for both Athenia Healthcare and for the Public Housing Authority. We are going in and doing actual health screenings. So doing blood pressure checks, A1C, cholesterol, smoking screenings. We're doing the substance abuse screenings. So we're doing all of these screenings on our event on May 23rd, and we have several partners who are coming to assist us with this event. And then from that event, we're also doing the Prepare tool and the health assessment, and we will use that data in order to create the actual community follow-on program for bringing education and resources into the public housing communities. Next is our data. What data do we have to augment our observations? As I stated before, we have developed an electronic version of their health assessment for the public housing community, and we have also developed our version of the Prepare tool in an electronic version to be able to, again, assess, if this patient on today was a high risk, over the next few visits, or is their risk declining, or is it staying the same, so that we'll be able to track our efforts better. We will analyze the data to determine the needs of the community, and again, we are working with the Public Housing Authority to actually develop a health plan, which is a part of their strategic plan as well. Currently, the data we have is only for our internal processes. So getting the electronic version of the health assessment and the Prepare tool is going to be essential for making sure that we are able to speak in data terms of the efforts that we're doing out in the community. And we are taking our internal assessments and developing the community approach to assessing and addressing health and healthcare needs.
Great, thanks so much, Sonia and LaTonya. It's great to hear about what you've been working on with Prepare. The Prepare tool, for anybody who's unfamiliar, is a social determinants of health kind of screening tool that can be implemented through the EHR into like the regular clinical workflow. So let's get to that, but let's go back a minute on the case about your 41-year-old patient who wants to quit smoking but hasn't been successful yet. Let me ask one clarifying question, and then I'm going to open it up to the group. Sonia and LaTonya, has your patient had any quit attempts so far, or not yet?
Has she had? Yes, she has had several attempts to quit.
Okay. How has she tried to quit? Do you know?
She started using e-cigarettes, and then she also was using nicotine gum.
Okay. Great.
And then she's also, I'm not sure what the logic is with the community member, but she also started smoking marijuana to replace cigarettes.
Right.
Due to some of the the thoughts behind marijuana versus cigarettes.
Sure. It sounds like she's had some, pretty significant life stressors, and maybe does have some underlying depression or anxiety or other mental health concerns as well. Yeah. So any other clarifying questions from the group before we sort of start some discussion on how we can help this patient more?
Yeah, could you, Sonia, could you clarify her housing situation? You mentioned she'd recently lost housing, so I'm guessing she's in public housing now. And then also, is she in counseling now?
So she is living with family members, so her housing situation is really unstable. And then you asked the question, I'm sorry, the second question?
The second question is she in counseling of any kind now?
Professional counseling, no. She does have her family, which is a support to her, but she's not in professional counseling.
Got it, thanks.
Laura, it's Linda. I had one clarifying question too. Thanks, Sonia, for the presentation and writing up the case.
Sure.
In the write-up, I noticed you mentioned she had bipolar disease. Do you know if she's being medicated for that?
That she reported, no. The two things that stood out to us is the bipolar as well as the high blood pressure. So we're actually connecting her back to her primary care physician for those things.
Great, good question, Linda. I have one other question, Sonia and LaTanya. Does she have a sort of usual source of care, like a regular primary care doctor that she sees regularly, or is she seeing a bunch of different people at the health center? Do you know?
Okay. LaTanya stated that she believes that she's just seeing a bunch of different people. She doesn't have one steady, stable provider.
Sure. Happens. We understand lots of challenges there, but that's one. From my standpoint, family physician, that's one recommendation, which it sounds like you all are working on. But for her to have kind of a usual source of care to build a relationship over time, maybe tie up or investigate some of these loose ends a little bit better. That might help some. Let me open it up to others for thoughts, advice, recommendations, things to do to help this member quit smoking for good.
Okay, this is Frank. Well, there's probably at least 20 things you could tell me with this person. I'll try to limit it to a few, the most important. First of all, I would point out to her that her use of the e-cigarettes and the marijuana apparently is not working if she's still smoking 2 packs a day. So definitely try to get her to minimize those as much as possible. Then I would really, what Amy mentioned in the presentation, was to help her cut down at least to maybe a pack a day, because she's getting a lot of nicotine there. So in many cases it's a little more difficult to replace that high amount with the nicotine replacement therapies. So I would work on getting her down to at least a pack a day. Try to get her to eliminate the e-cigarettes and the marijuana. And you can also, there's no data that marijuana helps you quit smoking. So, that you can just point that out to her. Secondly, because of my orientation and what I do so much with patients in my education, is I keyed in on the word friend, that she sees her cigarettes as friends. So I think you really have to, with somebody like this, work with that particular idea and actually frame this as a relationship, which she's already saying it's a relationship, but in terms of an abusive relationship. So she thinks she can't live without this person, this thing, but actually what it's doing is harming her. It's ruining her health, it's killing her, et cetera, et cetera. So it's helpful for you to change that, reframe it from her thinking it's a good friend to actually pointing out what it really does. And the phrase I always use is, what kind of friend would ruin your health, steal all your money, and destroy your self-esteem? So, that phrase helps people to start to reframe that. But importantly with this individual, and I use this a lot with women, especially in this situation, it helps for them to actually break up with the cigarette. So again, frame it like that she needs to do something to finally say psychologically, I thought I loved you. I thought you were helping me. I thought I couldn't live without you, but hey, you're really killing me. You're really messing my life up. And so I'm done with you. And to actually, when she's ready to do it, have a quitting ceremony. So have her do something that is meaningful to her that says, I'm done, it's over, goodbye. So I find that very helpful from a psychological perspective to do that. I also think that, and I think you're moving towards this, that she needs to have some kind of psychiatric treatment too, because she is, as Amy pointed out, many people do in this situation, she's self-medicating with the cigarettes. So those would be the three top things I would focus on.
So this is Steve. Those are great comments by Frank. I would just add a few other things. One is, from a medical standpoint, I mean, she's got a real consolation. She's obese, she has high blood pressure, she has asthma, and my guess is you're going to find that she has diabetes. So managing those, even if she wasn't smoking, is a real challenge. And of course, if she stops smoking, she's probably going to gain weight. So she needs to be ready for that. She's clearly undertreated for smoking cessation and for her chronic psychiatric problems. So she needs to get into treatment. Maybe either bupropion or varenicline would be an easier thing for her to take, because it would help her, it would lower the cravings. 2 packs a day is so off the scale now. It used to be that was a common, a lot of smokers are doing that, but now the average number of cigarettes smoked by a smoker is only 14. So she's way at the high end. And you've got your hands full. So my congratulations to you folks for taking a hold of her, understanding her, working with her, and being very tenacious. This won't be easy, but I really commend your efforts, and I hope you'll stick with it.
Thank you.
Yes, thank you.
Thanks, Steve and Frank. Any other thoughts or suggestions, recommendations from anybody, either from our faculty or others? I saw Linda had a nice comment too, just want to make sure everybody saw that the quit lines, that a lot of people who call the quit lines 40%, and maybe that's, maybe some people don't actually self-report, but so I would estimate that might be even higher, but 40% of quit line callers by the good data that NAC has have or report a behavioral health issue. And that the state quit lines often have special protocols to help people with behavioral health conditions. That's another partner. I know you're working with them, Sonia and LaTonya in Missouri, with the quit line to help support your efforts as well.
Hey, this is Bob. I have just 2 quick points. And one is to address the housing instability issue, which I'm sure you're already thinking of, and you're using the Prepare tool, which is a great idea. It sounds like there's some family support there now, so hopefully you're going to kind of build that into the process. But for the long term, you need to kind of figure what her housing situation is going to be, because that itself is anxiety-inducing and may contribute to it. And then the other issue is just, as with a lot of smokers, particularly in public housing, who are isolated and maybe have some physical issues, some kind of alternative activity Steve mentioned the potential for weight gain, and just, physical activity of whatever kind she's able to do. If you can get her into that, would be a great help. And then just other activities, so she's just not sitting there thinking about smoking.
And this is Steve. One other thing that I forgot to say is she has an event coming in her life. She's going to have a grandchild. And the parents are probably not going to want to expose that grandchild to secondhand or third-hand smoke. So this is a wonderful motivator. She wants to not present herself as a smoking grandma, and she wants to be living when that child graduates from high school. So those are ways to give her something to replace the friend that she's going to lose that Frank spoke so eloquently about.
Yeah, great point, Steve. Those are going to be very, very motivating and helpful to help our patients sort of see those ramifications. Now, this is a great case, Sonia and LaTanya, and Frank said he had like 20 recommendations. I think he shared his top 3 or 4. So what I would suggest is that you go back and do this and then bring this case back to us, because this is the whole value of our kind of ongoing continuous relationship together, that we have a usual source of care for ourselves as healthcare providers to continue to get advice and help along the way. And especially with patients like this that are complicated medically and from a mental health standpoint, and also have some real significant structural and social determinants of health that are impacting their lives. So thank you for the great case.